cardiovascular disease. A bit of a background for myself. I've worked at Mackay Base Hospital and the Princess Alexandra Hospital. In relevance to cardiovascular disease, I've worked on the cardiology wards, I've also worked on the cardiac rehabilitation team and the heart recovery service team. So hopefully a lot of my experiences that I've had in the acute setting can be transferred across to today's online module to help you guys out. The content that we'll be covering today will basically be looking at the definitions of cardiovascular disease and the conditions within that. We'll be looking at the etiology, how it occurs, and how it affects the individual, the risk factors involved, and also the medical management. It will be quite a quick lecture or online module. It'll be about 15 minutes. So let's get into it. Cardiovascular disease is essentially any sort of disease to do with the heart or the blood vessels. The main types that we see in Australia are the coronary heart disease, CHD. We've got peripheral vascular disease. We've got heart failure or cardiomyopathy. And lastly, we have stroke. The stroke content will be covered in a separate module. So today we'll just be focusing on the three. Bit of statistics, just to let you guys know, in 2017 to 2018, 1.2 million Australians had heart disease. As you can see in the graph on the right there, it is more prevalent in the older population, as we'll talk in risk factors soon. It is more common in males as well. And looking at the total mortality rate, we've got 27% of the Australians who passed away in that time frame were attributed towards cardiovascular disease related conditions. Looking at the risk factors for cardiovascular disease, we've got two different types. We've got modifiable, which we like to focus on in the hospital, and we've also got the non-modifiable or the unchangeable. So things like sex, age, family history, it's a bit out of our control, so we like to focus on the modifiable. So things like smoking, alcohol, high cholesterol, high blood pressure, diabetes, all those things affect your risks of having cardiovascular disease, as well as being above the healthy weight range, stress, and even depression. When we look at coronary heart disease, essentially we're looking at the coronary arteries of the heart and what's known as ischemia. So when you get plaque buildup in those coronary arteries, it restricts the blood flow to the heart and it can make the heart O2 deficient. And this can lead to things like angina, so chest pain, myocardial infarction, otherwise known as heart attacks. You could have a stroke or even sudden death. So coronary heart disease is quite a very serious condition, but fortunately we do have some dietary interventions to help reduce the formation of that plaque. Peripheral vascular disease is quite similar, except it's just looking at the blood vessels and the extremities. It reduces the circulation to body parts, so your arms and your legs, and this is again due to plaque buildup, narrowing the blood vessel. The outcomes of having PVD could be functional impairment, you could have limb ischemia, perhaps delayed wound healing, which we see a lot in diabetic patients, ulcers, or even worst case scenario, if the blood vessels become occluded, it could turn into amputation and the individual will have to get their limb removed. The last condition we're covering today is heart failure. So heart failure is essentially structural abnormalities or affecting the cardiac function of the heart. So as you can see there in the schematic on the right, you've got the normal healthy heart, which in the left ventricle, that's what a normal healthy heart should look like. It's got a good ejection fraction, everything's going well. In the heart failure patient, it's dilated, so you're gonna get more pooling of blood, and it's gonna affect the individual, creating things like shortness of breath, chronic tiredness, fluid buildup, so edema, declining physical capacity, could land the person in hospital for those reasons, and worst case scenario, death. Metabolic syndrome is an important one to be aware of. Those dot points that I've mentioned there, this is just very brief, but essentially if you're diagnosed with 3 or more of those, does put you at potentially having metabolic syndrome, which puts you at a higher risk of having cardiovascular disease. So for example, if someone had high triglyceride levels, high blood glucose or sugar levels, and they also have high blood pressure, then they could be at risk of having metabolic syndrome. Some other factors to look at: smoking is the #1 cause of preventable death. So it does directly influence coronary events. It could cause thrombus formation, plaque instability, arrhythmias in the heart, or even formation of that atherosclerosis. So it is important. That's why when people are admitted to hospital, the doctors tend to ask if the person's smoking, and they forward them to the appropriate resources or quit lines to help out. Stress is another factor to be considerate of. So stress increases the heart rate, which increases the blood pressure. And essentially the effects of chronic stress is the same as having hypertension. So if your blood pressure is quite high, like I mentioned earlier, you can get all those effects in your body that severely compromises your cardiovascular system. Cholesterol and triglycerides. We're just going to briefly touch base on that today, but we will go into it in more depth in the next online module. So cholesterol is produced in the liver. It helps build your cells. If you look back at your biochemistry sort of lectures there, it helps with vitamins and creating hormones. When you look at the types of cholesterol, so we've got things like LDL and HDL. LDL is low density lipoprotein, and what we refer to this one is more of, I guess, the bad cholesterol, where it creates that plaque formation and it deposits itself in your blood vessels. Whereas the HDL is the good one, where essentially it'll pick up these plaque formations or the fats in your bloods, and it'll transport it to the liver. So when we look at our lipid profiles in our blood, we want to try and make sure that our HDL levels are high and our LDL levels are low. Triglycerides, now they're readily broken down for energy, and they can also be unsaturated or saturated, which we will touch base in our next online module as well. Hyperlipidemia is just the umbrella term for high cholesterol and or triglycerides. The reasons why someone may have hyperlipidemia could be because of excess alcohol intake, a high fatty diet, high carbohydrate or sugar intake in your diet, or poorly controlled diabetes, perhaps some underlying genetic conditions or genes in the person, or maybe even secondary to certain diseases. And some medications may also affect this as well. Overall, when you look at the medical management of cardiovascular disease, it can be diagnosed through ECG, chest x-rays, ultrasounds, plasma enzymes, angiograms. The medical team will do all of this, so you don't really have to worry about that sort of stuff. When it comes to the drugs, there's lots of drugs out there, but I've just named a few here on the slides, which will help reduce the LDL or the triglycerides or the cholesterol in that person, and it'll help make sure that it's at a lower level. Surgical, so if you've got coronary heart disease and you've got that plaque formation, you may be eligible for a CABG or a coronary artery bypass graft. There may be stents, there may be other surgical interventions that the treating team will need to do. And when an individual comes into hospital for, say, a CABG or for those coronary stents, the dietitian does usually get involved or touch base, especially if it's part of maybe a cardiac rehabilitation program, where we like to talk to the person about low salt diets, perhaps the Mediterranean diet, just the Australian guideline to healthy eating, so just whole foods, having that variety, plenty of vegetables. Or if it's quite severe, if they have heart failure, then we also look at fluid restrictions, which the medical team will identify. So maybe 1 liter of fluid a day or 1.5 liters a day. Weight management is also another important factor to look at. Some other things, like I mentioned earlier, smoking cessation and increasing physical activity are all ways that we can help manage cardiovascular disease. I've also got some readings and resources for you guys to check out in your spare time, and they'll be linked in the online module as well. Thanks.